First, we begin today by talking about our daily COVID numbers. And yes, they are once again over that 3,000 daily case threshold. It's the fourth time we've actually hit that spot. 3,303 new cases now in the past 24 hours.
Meanwhile, 174 patients were hospitalized in the last 24 hours. Now, around the state of Ohio, there are now 1,641 people in the hospital with COVID. That's 6% of our state's hospital beds. Just 1 week ago, we were at 4.3%. The spread continues, and Monica Robbins, our senior health correspondent, joins us now. President Biden just wrapped up his press conference, his message for the nation today, and he had quite a bit to say specifically about COVID, schools, and he laid out a lot of stuff.
Yeah, he did. Three big points that the president talked about. The first thing is he is mandating nursing home employees to be vaccinated, or the nursing home could risk losing Medicare and Medicaid funding. He has the ability to do that. We know that 130,000 nursing home residents have died in the pandemic so far. He also is directing the Secretary of Education to use oversight against those governors who are blocking schools from putting in mask mandates. And we know that there are 8 states currently that have those laws in place. And that's something very, very huge that the governor, or that the president is saying, because his legality there may be challenged, definitely, because he can't really necessarily do that. But when you throw the Secretary of Education in, there may be some loopholes. So it'll be interesting to watch and see what happens.
Probably tied to funding for those states.
No doubt.
Because, yeah, the federal and the state statutes are certainly going to be questioned here. One thing that I want to ask you about is the booster shot, because that's all the talk right now. It seems that he has a very defined plan moving forward for who can get them and when they can get them. What did you take from it?
All right, well, we've all known boosters might be likely now, and now the plan is to get ahead of the virus and get the boosters in arms before they're actually needed. So while the vaccines are still relatively good at decreasing your chances of hospitalization and death, research around the world is showing it may decline there as well. So a booster plan is in place for those over age 18. So those who are immunocompromised can make appointments for a third dose right now. Pending FDA and CDC approval, the week of September 20th, third doses of Pfizer or Moderna vaccines will be made available to nursing homes, the elderly, healthcare workers, and emergency workers, anybody who got vaccinated before January 20th. Now, those 18 and older will be eligible 8 months from the date of your second dose. The J&J vaccine will also likely need a booster, but research is still being conducted. And remember, that one didn't start until March, so there is time to wait. So why is this happening? Lots of reasons.
We're watching other countries, the experience of other countries carefully, and concerned that we too will see what Israel is seeing, which is worsening infections over time.
You don't want to find yourself behind playing catch up. Better stay ahead of it than chasing after it.
90% of Americans live within 5 miles of a place where they can get their free vaccine. You don't need to get your vaccine on the actual date you're eligible, but as close as possible, and you will need your vaccination card. And because of it's only 18 and up, the reason for that is that the FDA is still needing to figure out whether or not the dose for a third dose for those under 18 is safe. So that's why. But you know what? They got theirs later too, so there's time to wait.
Many of those questions that we didn't have answers to, such as how long will the vaccine be effective for? Will we need that? Those now, we're starting to fill in those blanks.
Yeah, and the thing is, we're seeing it from elsewhere in the world because they've been dealing with Delta longer than we have.
Right.
So the plan here is to get ahead of it and get these boosters in arms before we're dealing with what everybody else is dealing with.
And we're going into our cold season, which is when everybody expects this thing to spike again. So it's all coming together at the same time.
You got it.
Monica, thank you.